Are you pregnant or plan on becoming pregnant while working as a nurse? I've worked up until my due date with all 4 of my pregnancy, even went into labor with baby number 3 while at work. I'm here to share all my tips with you on how to be safe and an effective nurse while being pregnant. Welcome everyone to the Mama Nurse channel. I'm Vanessa, and here we discuss all things nursing, motherhood, and lifestyle. Please make sure you subscribe to the channel so you don't miss out on any uploads. Don't forget to leave a comment down below. If you are pregnant right now, let me know how far along you are and what pregnancy this is. I've had 4 babies during my career as a nurse, and I've worked up until my due date with all 4 of them. So as a nurse, you know all about advocating for your patient. The moment you find out that you are pregnant, you have to start advocating for yourself and your baby. If your assignment is inappropriate, speak up. It's okay. Just don't take advantage of the situation. Be reasonable, and if you're like me, during those first 12 weeks, you want to be discreet with your pregnancy, just in case, God forbid, anything were to happen. But you can do this by talking to your manager and or your charge nurses and keeping that information between those people. That way they can make the assignments more appropriately and safer for you and baby. Know what patients you can and can't take care of. Big tip, avoid patients who are on droplet or airborne precautions such as TB and shingles. Avoid combative patients. You wouldn't want to risk getting hit in your stomach and hurting baby. And avoid patients who are on chemotherapy or getting chemotherapy or radiation. These are the main types of patients that you would want to avoid during your pregnancy. You want to make sure that you're asking for help at appropriate times, such as for turning patients, doing pull-ups in bed, during baths, and things like that. You want to make sure that you're staying hydrated by drinking plenty of water during your shift. I know this will increase your bathroom runs, but trust me, it will be worth it. You will feel more energized and not get short of breath as often while working those 12 hours. Make sure you are eating nutritious snacks. Fruit, yogurt, granola bars, these are some of the best options. Once you become pregnant, the personal questions will start. What are you going to name the baby? What's your birth plan, etc.? Don't feel obligated to discuss these things if you're not ready to, or if you just don't want to. Try to switch the topic or politely say, hey, that's not something that I would like to discuss right now, and just let it be. That's okay. Don't let people make you feel obligated to disclose all of that information if you're not ready to. I once had a family member argue with me about wanting to have a natural birth. She proceeded to tell me that I needed to get an epidural, and it started to make me feel a little bit uncomfortable. So I politely told her, I've discussed my birth plan with my physician and my spouse is on board, I'm on board, so that's what we're gonna go with. I thank you for your consideration, and I exited the room. It was simple as that. People will put you in awkward positions at times, but you don't have to let that affect you. Just proceed with your day. At your doctor's visits, you want to make sure that you ask if you're under any restrictions. If you are, relay this information to your charge nurse and manager. That way they can accommodate you during your shifts at work. If you're not under any restrictions, then you just want to use your best judgment. If something doesn't seem right or doesn't feel right, don't do it. Ask for help. Team members are typically willing to help you prior to pregnancy, but more so even when you're pregnant. So make sure that you ask for that help. Don't push yourself and don't push baby. You have to remember that you are carrying and growing a baby. You can't do the things that you once were doing as far as pulling up patients and turns and all of that. So you need to make sure that you have a good team on board that is willing to help. Want to start saving your PTO. From the time that I find out that I'm pregnant, I try not to use my PTO. If I have to, then I have to. But what I try to do is arrange doctor's appointments on my days off, schedule myself to where I get days off in a block of time for what I need. That way, when I do go on maternity leave, I can use that PTO and it could be used as an extra paycheck while you're on leave. So try to save and conserve that PTO that you do have. It will help you with your maternity leave. What's your biggest fear about being pregnant while working? Drop a comment down below. I think my biggest fear during pregnancy was hitting my belly. I've always been a very slim girl, and I could squeeze in any which way that I needed to maneuver in a room or whatever the situation may be. When I was pregnant, that was not the case. I always had a big belly in front of me, so I had to maneuver in different routes, but it worked out in the long run. I had great pregnancies, great deliveries, all while being a registered nurse. Bonus tip, make sure you invest in long sleeve, stretchy shirts. You can wear shirts that we typically as nurses wear under our scrubs because, believe it or not, your scrub tops are not going to fit like they used to. If you invest in those shirts, buy the same color as your scrub tops. It's going to be more comfortable, more breathable, and you won't spend your shift pulling your scrub top down. Trust me, it's worth it. Until next time, all love.